Seema, what is the situation currently in Italy?
Well, there's clearly been a surge in the number of new daily infections, hospital admissions, as well as deaths, unfortunately. Now, we're averaging about 30,000 or so daily new infections in the last few days. Now, that's a tenfold increase if you compare to the previous month. But the key factor is the admissions in the intensive care units in hospitals across the country. Prime Minister Giuseppe Conte, speaking in Parliament today, said that the ICU or intensive care units in hospitals in 15 out of the 20 regions of Italy, if they continue in the same phase that they're going at now, the same rate, they will be overwhelmed by the next month. And so therefore, clear action needs to be taken. And so what he has said today is that they're planning to curb travel between the worst hit regions like Lombardy and Piedmont up in the north of the country, as well as in Campania in the south. That's the region around Naples that's been hardest hit. They're also planning to introduce a nighttime curfew, although we still don't know the details of exactly at what time that will start, and that will be across the country. And also cutting down occupancy in public transport to 50% as opposed to what is it now, which is 80%. And middle and secondary school students also expected to go only on online learning. But we'll have the details once that decree in terms of how these new measures are going to be put in place is released within the next few days.
But given what you've just been saying there, Gupta, about the figures surging in Italy, just how long can authorities hold off from imposing a national lockdown?
Well, that's really a tough one, Annette. I mean, they really have to sort of balance out the health versus the wealth in terms of the economic and political interest. It's interesting to note that this decree is coming. It's the fourth in less than a month. So clearly they're seeing a need to increase those restrictions because they're looking at the figures in terms of the number of daily infections. Now, Italy so far seems to be playing catch up compared to some other European countries in terms of putting in place these restrictions. And Prime Minister Conte, for his part, had said very clearly early on that he wants to do everything to avoid a national lockdown because of those economic and political pressures that he's facing. But that said, he feels necessary right now, these restrictions, despite the fact that we've also seen anger on the streets of Italy with protests by different groups, people angry at these restrictions. He says he understands their anger, but you can't argue with defending people's right to health. And so it's a balance, and they're trying to get to it. Virologists are saying, however, it's one thing to put in place lockdown measures that should be able to control the contagion, but it's very important to continue with testing as well as contact tracing, even after an eventual lockdown is lifted.
Seema Gupta reporting there from Rome. Thank you.